5 reasons why we love OBGYNs. 5 reasons why we love OBGYNs. Hi, y'all. So I'm Dr. Fatou Forna. I am an OBGYN who works to keep pregnant women safe here in the US and around the world. Today I'm going to talk about OBGYNs and why we love them. I'm an OBGYN, so I'm a little biased. I know we love OBGYNs, well, maybe most of the time. Sometimes women are scared of their OBGYNs, and I think it's because a lot of the stuff we do is associated with pain, so I get it. But in general, I think most women bond very deeply with their OBGYNs during their pregnancy, and they form lasting relationships with them. All right. So, number 1, we love OBGYNs because they are the pregnancy expert. OBGYNs are pregnancy experts for normal pregnancy, for abnormal pregnancy, low risk pregnancy, high risk pregnancy. They really, that is what they study. It takes about 16 years to be an OBGYN, an obstetrician gynecologist. You have to go to college for 4 years and get your first degree. Then you have to go to medical school for 4 years to get your medical degree. And then you have to do residency training for another 4 years. This is 4 years of clinical training when you're providing care to women and kind of learning on the job. So 16 years of training, delivering, hundreds and thousands of babies, doing tons of surgery. That's what it takes to kind of understand, to become an OBGYN. You also take multiple board exams, multiple exams throughout medical school, of course, getting into medical school, throughout medical school to become a doctor. And then as an OBGYN, you take multiple exams to become board certified. And then to maintain your board certification every year, you're taking exams, they're kind of testing you and you're doing articles to stay on point. So because of that, OBGYNs are the pregnancy expert and they know what to do to take care of pregnant women. All right. Number 2, there's a pregnancy bond. When we take care of women during that whole 9 months of pregnancy, we get to know you very well. We get to know your family. We get to know, things you like, you don't like. There's just an amazing bond that happens during those 9 months. We're taking care of you. And then when we deliver you, we get to see that baby. We get to see your healthy baby's healthy. It's just nothing like that. For me, I love being an OBGYN. I love pregnant women. I love that bond. I have many patients that that bond exists and seeing the babies and seeing babies grow up. Those are my babies. So that's something that's special, and I'm privileged to have that experience and to be, for women to trust, to give us that trust. All right. Number 3, we love OBGYNs because they care for 2 patients, not 1, 2 patients. And, that requires a lot of skill. We're caring for mom, we're caring for baby. At every point in the way of the time, we're making sure what we do for mom, we know we're keeping an eye on how it impacts baby. We have to make sure we're providing that care for both of them to have good outcomes for 2 people at the same time. So again, a lot of skill, it's a lot of responsibility, it's a lot of anxiety, a lot of liability, but that's what we do and we do it well. So we love OBGYNs because of they care for 2 patients. There are very few doctors who care for 2 patients at the same time. All right. Number 4, we love OBGYNs because they handle emergencies calmly. A labor and delivery ward, Lord Jesus, it is something else. Most of the time things are fine, but shit can hit the fan fast. I mean, things might be okay. The baby decides, I don't like this. I'm going to drop my heart rate. Or the mom's blood pressure shoots out the roof. Or mom has a seizure. There's just all this stuff that can happen. Majority of deliveries, over 90%, are perfect. Nothing happens. But boy, some of them can have problems. So we have to be able to handle emergencies calmly. We have to be calm under pressure. OBGYNs can get a baby out within few minutes. If you see an emergency, the baby's heart rate drops, you have to get that baby out within 5 minutes, a lot of times for the baby to survive and not have problems. So we can do something called a stat C-section, an emergency C-section, where we rush you out and get a baby out, within a minute from when we make that first incision. This is what we're trained to do. And we might be shitting bullets, we might be sweating, but we need to be calm, direct everyone in the room, do what we need to do, and then maybe walk out of that room and cry. Cry out of relief that everything went well, or if there's a bad outcome, cry because of that, or you're worried because you love your patient and they're suffering. So it's a lot. But again, there's a particular type of personality of people that enter OBGYN, I think, for these reasons. All right, number 5, we love OBGYNs because they are the boss. Yes, they have to be in charge of your pregnancy care. They have to lead that team of midwives, of high-risk doctors, perinatologists, of specialists, anesthesia. So they need to know when something's wrong, we need to send you here to get help, or we need to call this specialist, we need to do this, we need to ask the nurses for help, anesthesia. So they really have to take charge in your care. Because at the end of the day, they're in charge of making sure we have a healthy mama and a healthy baby, because that's the most important thing when you step into our office and you're pregnant, or you step into that labor ward and you're pregnant. That's top of our mind. Healthy mom, healthy baby, healthy mom, healthy baby. So Black women, I am sharing this important information about OBGYNs because OBGYNs are really a critical part of your delivery team that you need. Not only your delivery team, of your whole pregnancy care team that you need to survive and thrive during pregnancy. All right, bye.